With around 28 million people infected and approaching 1 million dead, the global coronavirus pandemic continues to exact a heavy toll. But after the first appearance of COVID-19, could the World Health Organization have been more effective in coordinating the international response? A few months into the crisis, a team of Swiss-Italian filmmakers went in search of answers.
We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
When the Director General of the World Health Organization made this announcement on March 11, 2020, it came as little surprise to anyone. By then, from its origins in Wuhan, China, the coronavirus had been spreading internationally for at least 2 months, already infecting 118,000 people in 114 countries. As we now know, tens of millions more would eventually be infected, and to date, at least almost 1 million people have died. As things stand, the COVID-19 pandemic is far from over. Yet back in those early uncertain weeks, as the world was waking to an unprecedented threat, the WHO came under fierce attack. The agency is responsible to the United Nations for leading the global response to contagious disease. But critics accuse the organization of failing in its mission and of reacting too slowly to the appearance of the coronavirus. Some even claimed it had been too ready to believe what it was first told by the Chinese government about the nature and severity of this new disease. As these criticisms grew, we went to WHO headquarters in Geneva to find out if its senior officials could have done more, sooner, to alert the world.
Noi riceviamo il 31 dicembre il primo allerta. Il 1 di gennaio chiediamo alla Cina informazioni aggiuntive attraverso il nostro ufficio, sia di Pechino che l'ufficio regionale. Il 3 di gennaio l'ufficio Cina comincia a interagire formalmente con il governo cinese. Insomma, il 5 di gennaio è il momento in cui viene fatto il primo risk assessment da parte dell'organizzazione. Non mi pare che abbiamo cercato di favorire, di nascondere o che altro.
On January 5th, the WHO issued a reassuring press release about a mysterious new disease. On the 31st of December 2019, the WHO China country office was informed of cases of pneumonia of unknown etiology detected in Wuhan city. A total of 44 patients with pneumonia of unknown etiology. Based on the preliminary information from the Chinese investigation team, no evidence of significant human-to-human transmission had been reported. WHO advises against the application of any travel or trade restrictions on China. But if all was still calm in Geneva, in Taiwan, an infectious disease specialist had been having sleepless nights.
So that was December 31st, the last day of the end of the year. I saw it around 5:30 because I woke up pretty early that day. It just happened I couldn't sleep well. A young medical officer picked up that message and posted that to our line group, and found it very interesting but also worrying. There was a post about a mysterious outbreak of pneumonia in Wuhan, China.
Dr. Lo Yi-chun is the Deputy Director of Taiwan's Center for Disease Control. He says that from the outset, there were 3 crucial indications that something very serious was happening in China.
The first is it's an official announcement by the Wuhan health authorities to the hospitals. Authorities were reminding the hospital there is an outbreak of pneumonia happening in hospitalized patients. So be careful about detecting those cases. And the second message, doctors reminding each other that, well, be careful because it could be dangerous to us. So be careful that these patients were isolated. And the third message was about doctors chatting about, well, in my hospital, I found so many cases of Wuhan pneumonia, and they seem to be associated with Huanan seafood market, and the preliminary laboratory results says it's probably SARS.
The 2003 SARS epidemic, which also began in China, infected over 8,000 people around the world and killed 73 people in Taiwan. One of the worst affected countries, it had left the Taiwanese very sensitive to the dangers posed by viruses capable of human-to-human transmission. In order to limit any such threat, the authorities knew that very strict containment and isolation measures would be necessary.
Around 6:30, it's still early, but generally it's okay for me to post something in our colleagues' web chat group. So I send a message on that chat group saying, well, there is an important message I just saw earlier on, and we need to clarify that with the Chinese authorities.
But the Center for Disease Control didn't just ask Beijing for more information. On December the 31st, it also raised the matter with the WHO.
The letter says news sources today indicate that at least 7 atypical pneumonia cases were reported in Wuhan, China. Their health authorities replied to the media that the cases were believed not SARS. However, the samples were still under examination and the cases have been isolated for treatment. I would greatly appreciate if you have relevant information to share with us. Thank you very much.
However, Lo Yi-chan and his colleagues at the CDC believe the WHO ignored their early warnings about the virus because Taiwan, over which China claims sovereignty, is barred from full member status.
Well, we want to check, number one, if the health authorities in Beijing or in WHO, they are on top of this event, if it's really an event. And number two, confirm it's SARS or not. It's not SARS, what can it be? And are you still investigating or not?
Their email has since been at the center of a row between Taiwan and the WHO. According to Taiwan, the fact that patients had been placed in isolation was an intrinsic alert of a human-to-human transmitted disease.
Che vi fosse il rischio di trasmissione interumana, in fondo dai primi documenti consegnati all'OMS da Taiwan il 31 dicembre c'era già.
No, mi scusi, perché su questo bisogna ugualmente essere chiari. Taiwan non ha dato indicazioni, ha soltanto chiesto informazioni e queste informazioni sono state fornite.
But we thought, well, the message we provided to WHO, in addition to requesting more information, was also alert to WHO. You have to pay really careful attention to this event. They are in touch with Beijing. They didn't reply us with that. They say, well, thank you, we have received that.
Taiwan decided it couldn't afford to wait for the WHO. On December 31st, it began implementing its own emergency containment measures. Their response was to prove highly effective. Taiwan has a population of 25 million and sits only 93 miles from the Chinese mainland. To date, it has had 498 cases of coronavirus and only 7 deaths. Meanwhile, Lo Yi-chan says the Chinese authorities kept denying the problem.
The Wuhan health authorities put out a press release on December 31st and said, well, it's not SARS and there's no evidence of human-to-human transmission, but we still think ahead. We cannot risk the small possibility that it's really SARS. So after a thorough discussion internally at the agency and with the Prime Minister's office, we decided to start onboard inspection of all the direct flights coming from Wuhan since that day. And during that time, we had around 12 direct flights on a weekly basis from Wuhan.
By now, residents in Wuhan were also becoming alarmed.
Siccome noi abitiamo proprio vicini al mercato, poi è diventato famoso, poi è stato chiuso, quindi molto vicini, diciamo a 200 metri anche più o meno dall'ospedale centrale dove sono stati curati i primi casi e hanno scoperto che si trattava appunto di un nuovo tipo di virus. E abbiamo avuto l'informazione, se ricordo bene, proprio i primi giorni di gennaio, gli ultimi di dicembre.
Lorenzo Mastrotto is an Italian who's lived in Wuhan since 2006.
In quel momento hanno cominciato a pubblicare delle informazioni dicendo state attenti, se uscite indossate la mascherina, non toccate niente perché sembra che stia circolando un nuovo virus, poi piano piano nel giro di poco tempo hanno cominciato a chiamare questo virus la nuova SARS.
On January 23rd, 3 weeks after the first news of the mysterious virus had leaked, Wuhan was locked down. By then, over 1,000 people had been infected. What happened in those crucial 3 weeks in January has yet to be fully explained.
And throughout that 3 weeks, the Wuhan authorities almost issue a press release on a daily basis. And all these press releases just indicate two important messages. Number one, it's being controlled well. And I think there was at least 1 week, there were like 0 new case, 0 new case, 0 new case. So it's providing wrong reassurance to the world. Wow, this outbreak is being well controlled in Wuhan. Don't worry about that. Still, number two, they kept saying there was no evidence of human-to-human transmission.
The Taiwanese CDC had already implemented containment measures, but it remained in contact with China. On January 13, along with experts from Hong Kong and Macau, it sent a delegation to Wuhan to study the virus.
We have a meeting with the public health, local, central, provincial public health authority to discuss, to ask more questions about the clinical causes. At that meeting, they reported that there are 41 cases of the typical pneumonia. 28 were associated with Huanan seafood market. And 13 cases, there are totally no association with Huanan seafood market. At that point, I think we need to know about the epidemiology of the 13 cases. The chairperson of the meeting, who came from a local authority, he said that there's no evidence of human-to-human transmission at first, and we have a lot of discussion, and finally the central government official said that what you said was old information. Now we think limited human-to-human transmission cannot be excluded. I assume they will report to WHO very soon.
But that crucial news doesn't seem to have reached the WHO. On January 14, the organization's Director General, Tedros Ghebreyesus, tweeted that there was no evidence of human-to-human transmission.
Describing the situation as a pandemic.
But it looks like they just totally trust Beijing's messages. And all these 2 weeks, first 2 weeks in January, they were basically being a copycat.
WHO is a member state organization, so it is accountable to the member states, right? So they cannot order what member states can do. In the meantime, I think they need the Chinese government, right, to cooperate, right, with them. I think in the beginning, you basically take whatever, right, that the Chinese government has told them.
Yanzong Huang is a professor of global health studies at Seton Hall University in New Jersey and an expert on the Chinese health system.
WHO is not dealing with the local governments, they're dealing with the National Health Commission in China. Until January 20th, my understanding and my research suggested that even the National Health Commission was uninformed about the severity, the true nature of the outbreak. So there was clear local government cover-up by January 20th. Even though by that time it was an open secret in the frontline hospitals in Wuhan, there was human-to-human transmission. Right, the WHO still, basically adopted the official line and said there's no evidence of human-to-human transmission.
Se qualcuno può, intende biasimare la Cina, lo faccia, ma certamente non lo fa l'organizzazione, perché l'organizzazione con la parte cinese ha avuto una relazione assolutamente trasparente nel momento in cui, il 31 dicembre, la cosa è stata attivata. Noi non abbiamo nessuna evidenza che la Cina ha nascosto qualche cosa.
Yet, in early January, data collected by Chinese hospitals, later published by the New England Journal of Medicine, confirmed that there had been human transmission. It is proven that since mid-December, human-to-human transmission happened among people who were in close contact with each other. The first sick people came from the seafood market from January 1 to January 11, but over 80% of the patients had never been there. According to this same data, 70% had never had contact with the patients. Therefore, they had been infected by asymptomatic people.
Si è sottovalutata l'importanza della diffusione del virus attraverso gli asintomatici.
Non credo, guardi, ad oggi l'evidenza ancora una volta conferma che è entro i primi 3 giorni dall'insorgenza dei sintomi che la contagiosità è massima, perché vengono emesse goccioline e in queste goccioline è reperibile il virus. L'asintomatico per definizione non ha tosse, non ha raffreddore, non ha manifestazioni esterne per cui può espellere in maniera significativa il virus.
Ma guardi, il dottor Ranieri Guerra difende le posizioni dell'OMS che ormai tutto il mondo riconosce che sono sbagliate e che sono anche in parte responsabili della situazione in cui tutti noi siamo. Possono dire quello che vogliono, ma se noi avessimo saputo che c'erano gli asintomatici a Wuhan avremmo implementato misure completamente diverse. Nel senso, se viene uno dalla Cina, il fatto che non abbia la febbre e non abbia tosse non significa che non sia infetto e non sia in grado di trasmettere la malattia. Chiunque veniva dalla Cina o faceva il test o se ne stava in quarantena.
Virologist Andrea Crisanti is something of a hero in Italy, having led the fight against the pandemic in Veneto, where he is the regional scientific advisor. It was thanks to his intuitions on the contagiousness of asymptomatic people that the virus in the area was brought under control.
Guardi, noi abbiamo fatto sulla cittadina di Vo 2 campionamenti di tutta la popolazione al momento dell'inizio dell'epidemia. Noi il 26 febbraio sapevamo che a Vo c'erano 89 positivi, di cui il 40% totalmente asintomatici. Nel secondo campionamento abbiamo dimostrato che questi asintomatici erano in grado di trasmettere la malattia ad altre persone. Questi dati erano sotto gli occhi di tutti. Ma guardi, gli errori sono tutti uno più grave dell'altro. Voglio dire, affermare che la malattia non si trasmetteva da uomo a uomo, secondo me è una cosa da responsabili. Dire che le mascherine non servivano quando praticamente tutta la Cina, vedevamo in televisione, che usava misure protettive estreme, di nuovo lo trovo incredibile.
The face mask is probably among the number one important, successful factors that Taiwan can have controlled it well. COVID-19 is special because a lot of the patients are actually asymptomatic, which means they don't exhibit any symptoms. So if you only ask people with symptoms to wear a mask, you will miss a big proportion of those who can still transmit, but there was no protection of the patient to others.
Perché non si è stati così incisivi a ordinare a tutti di portare queste mascherine?
Perché ancora una volta l'organizzazione non si muove sull'ondata del sentimento, sull'ondata della richiesta popolare, mi scusi l'espressione. L'organizzazione si muove sulla base dell'evidenza scientifica. L'evidenza scientifica ad oggi dice che noi possiamo parlare a 1,5 metri di distanza, senza mascherina. Non la indossiamo anche per questo.
But a few days after this interview was recorded on June 5th, the WHO changed its guidelines on masks.
WHO Director General Dr. Tedros. In light of evolving evidence, WHO advises that governments should encourage the general public to wear masks where there is widespread transmission and physical distancing is difficult.
It's this kind of apparent inconsistency that has brought the WHO criticism, which the organization says is unfair.
inevitabilmente qualcuno cerca qualcun altro a cui dare la colpa di qualche cosa. Io non credo che l'organizzazione abbia fatto errori macroscopici, non credo che l'organizzazione si sia ritirata quando è stato il momento di dire come stanno le cose, di allertare il mondo e di dichiarare un gravissimo pericolo che stava incombendo.
But what still puzzles many is why it took the WHO so long to declare events in China a public health emergency of international concern. This fake notice would have galvanized the international community into an earlier and arguably more effective response. But weeks after the WHO was notified about the Wuhan outbreak, the matter was still under discussion.
Eventually was the WHO Director General decided to postpone the declaring fake and justify its action. It says that they used basically the government, the Chinese government provided information.
WHO is working with our partners night and day in China and the other affected countries at the regional level and here at the headquarters to fill the gaps in our knowledge as quickly as possible.
Widespread rumor in China is that if the fake is declared, then China will become a disease-ridden zone officially, and no country wants to do business with China.
Finally, on January the 29th, Tedros Ghebreyesus flew to China on an official visit.
Have started serious public health measures, and this is very, very important, and really we're proud that
instead of praising effusively Chinese response, you have to also recognize the initial mishandling of the outbreak. If they could just say, "Well, you did a great job of responding to the outbreak," even though in the beginning you mishandled, that at the local level. I think that would help WHO gaining more credibility.
On his return on January 30th, the WHO's Director General finally declared a state of international emergency. Border health checks were now among the measures it suggested to member states, 4 weeks after Taiwan had implemented the same procedures. But surprisingly, the WHO did not recommend any travel restrictions with China.
And WHO doesn't recommend and actually opposes any restrictions for travel and trade or other measures against China.
But the problem is that there's this inconsistency, incoherence, in the WHO guidelines. Because on the one hand, you were praising, the Chinese government for taking those drastic, even draconian measures, in limiting, the citizens' movement, in China. But in the meantime, you are telling other countries, don't impose those travel restrictions, continue to accept the passengers from China.
Non è che l'organizzazione possa prescrivere la chiusura dei viaggi o altro, lo può raccomandare. E i governi sono liberissimi di decidere il loro corso d'azione.
It would be another 2 weeks before the WHO sent its own group of experts to study the situation in China. Initially, the official program didn't even include a visit to Wuhan, the epicenter of the epidemic, where there were 56,000 cases of infection. After pushing back, the experts eventually spent 24 hours in the city. To the surprise of many, their final report continued to emphasize the WHO's position that contagion from asymptomatic patients was not clear and was in any case rare.
Mi piacerebbe chiedere al dottor Guerra che cosa sono andati a scoprire nell'ispezione che hanno fatto a Wuhan. Cosa hanno scoperto? Che dati hanno avuto? Su quali dati scientifici hanno basato queste osservazioni? Voglio dire, non è chiaro, non è un'affermazione scientifica, che tirassero fuori i numeri, perché la scienza è fatta di numeri.
Following the experts' return to Geneva on February 24th, it would be another 18 days before the agency officially declared a pandemic.
Say the situation now is pandemic.
Guardi, la pandemia è una terminologia che molta della stampa e molto dell'opinione pubblica guarda con estremo timore e ritiene che la dichiarazione di pandemia sia qualcosa che innesca chissà quali meccanismi. Non è così. Poi è evidente, ci sarà un momento in cui riprenderemo le fila, cercheremo di capire che cosa può essere migliorato in vista della prossima, purtroppo, epidemia che sicuramente ci sarà, e vedremo di non ripetere magari errori.